You'll often hear it said that Medicare-For-All is too extreme a position because many Americans like their private health insurance. While it sounds like the kind of propaganda you'd hear in an insurance commercial, many Democratic candidates have made some version of this argument. It's apparently part of their bold agenda to maintain the status quo. As I argue here, even if people like something, they can still support switching to something better. Satisfaction with the coverage and cost of Medicare is higher than it is for private insurance, and Medicare-For-All bills wouldn't just universalize the program as is, but they would radically improve it as well. Approval of our healthcare system scales with income, and many people in this country skip out on doctor visits or medications due to high cost. Problems and inequalities that single payer would eliminate. Private health insurance companies operate with a perverse business model of taking in as much money as they can while paying out as little as possible in healthcare. Contrary to what industry apologists will tell you, claim denial rates are at about 20%, despite the high amount that we pay in premiums. Much of the framing that's used by Medicare-For-All opponents is very deceptive and sometimes even turns the facts upside down. A system that tethers healthcare benefits to employers keeps people in jobs that they otherwise might want to quit. Yes, many unions fought hard for their healthcare benefits, possibly sacrificing wages in the process, but the simple solution to this once single payer gets passed is simply another round of negotiations that they would have eventually engaged in anyway. Opponents of Medicare-For-All dishonestly talk as if the program would take healthcare away from people and thus leave them in a worse-off position. As an example of this, listen to what Amy Klobuchar said in one of the recent Democratic debates.
I am just simply concerned about kicking half of America off of their health insurance in 4 years, which is exactly what this bill says.
Yes, and what else does this bill say that you're leaving out of your description? Medicare-For-All would eliminate duplicative private health insurance, but she's leaving out the essential detail that it would replace this private health insurance with comprehensive healthcare for all American citizens. The way she frames the conversation completely turns reality on its head, because she makes it seem like Medicare-For-All leaves fewer people with healthcare, when in reality it provides a full package of benefits for every single one of us, and it is our current system that leaves millions of Americans without health insurance. Klobuchar's deceptive wording here is nothing but a baseless scare tactic, and I don't know which is worse, her terrible arguments on healthcare or her incredibly corny, pre-planned one-liners. Bernie wrote the bill, but I read the bill. We're gonna build a blue wall and make Trump pay for it. Back in Minnesota, that's what we call all foam and no beer. Wow, Amy, you drink beer? That makes you so relatable to blue-collar workers in the Rust Belt. Next debate, she shows up like, look, I'm a Washington outsider, just like you at home. I love football, I'm addicted to opioids, and I'm dying of the black lung. There's also a related argument that making the switch to single payer would cause an enormous amount of upheaval, instability, disruption, and chaos to our healthcare system. For example, Joshua Morris writes the following for the Main Wire, quote, "A move as disruptive as single payer at this stage would eliminate private insurance, a benefit enjoyed by more than 180 million Americans. It would create uncertainty and chaos, hurting the very people it purports to help," ends quotes. Yeah, you should see the way things function in countries with single-payer healthcare. People go to the hospital and whatever they need is already paid for. Or as Joshua Morris would call it, complete fucking anarchy. Once again, we see that the framing here completely reverses the facts. Single payer would do the exact opposite of what he argues. Rather than creating uncertainty, single payer is actually the best way to combat healthcare uncertainty. It is under our current system that people are constantly losing their healthcare benefits, for any number of different reasons, including quitting their job, getting fired, not being able to afford their premiums, or moving to another state. If you want uncertainty and chaos in healthcare, there is no better way to bring it about than maintaining the status quo. Medicare-For-All, on the other hand, would provide all Americans with healthcare for the entire duration of their lives. No switching between providers, no waiting several months until your employer benefits kick in, no needing to transition from your parents' plan to your own. Instead, everyone always has healthcare, full stop. Medicare-For-All is really the perfect antidote to the very instability that they're pretending it will cause. Morris might as well argue that putting a roof over your head would make you more exposed to the elements. He also describes private insurance as a benefit that's enjoyed by 180 million Americans. Yes, if there's one thing we enjoy and love in this country, it's the profit-seeking middleman known as the private insurance industry. My hobbies include hiking, video games, and waiting on hold to speak with a Cigna representative. Maybe I'm nitpicking, but I feel like he's misusing this word here. Going to the dog park is something that people enjoy. Paying a monthly premium to Aetna seems like it belongs in a different category than this. While in this case it could have just been a poor choice of words, believe it or not, the immense pleasure that we supposedly derive from our private insurance is another one of the main arguments made against Medicare-For-All. John Delaney, for example, who supports a public option, argued the following on the Young Turks.
But the other thing is about 150 million Americans have private insurance right now, and 70% of them like it. So I just think it's a terrible idea for us as a party, as a matter of politics, to run on making those plans illegal.
The first thing worth establishing is a basic point of logic that Delaney seems to be overlooking. People can like something, yet still replace it with something better. If you would have asked me about my last car, for example, I would have said it's fine, I like it. My current car, however, is a hell of a lot better in so many different ways.
Literally 150 million Americans have private insurance, and Gallup just did a poll, 70% of them like it.
The polling data on health insurance also isn't nearly as simple as Delaney makes it out to be. He is correct that according to 2018 Gallup data, 70% of Americans with private insurance rate their healthcare coverage as either excellent or good. He fails to mention, however, that according to this very same Gallup survey, 79% of Americans on Medicare or Medicaid described their health coverage in the same way. They also found that 70% of those on Medicare or Medicaid are satisfied with their healthcare cost, compared against only 51% of those on private insurance. So I don't think it makes sense to describe switching to the more popular program as a losing political strategy. Delaney also described running on Medicare-For-All as political suicide. You know what's really political suicide? Being John Delaney. Dude is polling at 0.2%, and he wants to tell us how to run a political campaign. You couldn't even get 12 people to show up to one of your campaign events. You could have comfortably had that rally in my living room. And now, the man you've all been waiting for, John Delaney. One guy is like, yay. Now, this Gallup data I cited does combine Medicare with Medicaid, and considering that there's almost 2 times as many people on Medicaid as Medicare, one could argue, assuming this is a representative sample, that this data more so shows a satisfaction with Medicaid than Medicare. Fair point, so let's disentangle the two. 2015 Gallup data investigated satisfaction with the way the health system is working. Responses by insurance type were as follows: military or veterans, 78%, Medicare, 77%, Medicaid, 75%, union, 71%, current or former employer, 69%, and plan fully paid for by you or family member, 65%. Why 41% of the uninsured are satisfied is a complete mystery to me. I think what happened here is that they responded sarcastically and the Gallup pollsters took them seriously. Are you satisfied with the way the health system is working? Oh yeah, it's fucking great. Thanks for asking. From this data, we find that the average satisfaction rate of the 3 private plan types is 68%, compared against 77% for Medicare. Note also that people on Medicare are happier with their care despite the fact that they're mostly 65 or older, an age group that consumes about 3 times more healthcare resources per capita than everybody younger. One would think that more frequently interacting with the healthcare system and needing to pay for things more often might reduce your satisfaction with the system, yet Medicare satisfaction rates are about 10% higher than for private insurance. I would also note that these are the satisfaction rates of Medicare as it currently exists, with its many flaws and insufficiencies, in terms of coverage gaps, out-of-pocket spending necessities, and so forth. Considering that the Medicare-For-All bills would plug many of these holes and improve the program, presumably it would be even more popular than the current program. One last thing to note about 51% with private insurance being satisfied with cost. The satisfaction rate is this low despite the fact that according to the Kaiser Family Foundation, quote, the average percent of health insurance paid by employers is 82% for single coverage and 71% for family coverage, end quote. The Kaiser Family Foundation and the LA Times conducted a 2019 survey of Americans with employer-sponsored insurance, and they found the following, quote, 4 in 10 report that their family has had either problems paying medical bills or difficulty affording premiums or out-of-pocket medical costs. And about half say someone in their household skipped or postponed some type of medical care or prescription drugs in the past year because of the cost, end quote. They also presented people with the following question, quote, how well do you think the current health insurance system in the US works for people like you, end quotes. After waiting for the laughter to die down, they discovered that the higher the deductible, the lower the percentage of people who thinks it works well for them. And the higher the household income, the better they think our health insurance system works for them. So the question I would invite you to ask yourself is, should we have a multi-tiered, class-based healthcare system that caters to wealthy Americans, or should we have a system that serves all of our healthcare needs equally? And the thing is, no matter how good your health insurance is, sooner or later we're all going to end up getting screwed over by our current system. The people with more money can simply absorb it much better than others. The only people I see consistently winning under the system are healthcare executives. Another component of Delaney's argument against Medicare-For-All is that it would wrongly take away the healthcare benefits that union members fought long and hard for.
I mean, my dad was a union electrician, right? He was a 60-year member of the International Brotherhood of Electrical Workers.
Yeah.
And his union fought so hard to get him and us a great healthcare plan. And I just think about my dad and go to him and say, you're gonna lose this plan, which he loved, and he used to talk about all the time, and you gotta go on Medicare. He wouldn't wanna do that.
Yeah, well, he'd be wrong.
But he may be, but again.
I don't know, I feel like these conversations with his father just never happened. Hello, son, how was school today? It was good, father. How was work as a union electrician? Oh, you mean the job that provides me with a great healthcare plan that I love very much and worked very hard to negotiate? I had a good day at that job. Delaney doesn't seem to realize that he's actually making our case for us right here. Think about it. He's telling us about the Herculean, strenuous efforts that it took just to provide these union employees with a decent package of healthcare benefits. Benefits that are simply the norm and taken for granted in other developed countries with universal healthcare. Call me crazy, but I don't think that anybody in this country should have to go on strike and form a picket line and protest and engage in grueling negotiations for months with company executives just to be able to go to the fucking doctor when they're sick. We should have a system where all Americans have comprehensive healthcare, full stop, and they don't each need to individually fight for this in a long, protracted battle against management. That said, I do understand the point that many union members did expend a lot of time and energy to fight for their healthcare benefits, perhaps even sacrificing wage increases in the process. As Tim Ryan said in one of the Democratic debates before freezing in a pair of headlights, quote, "This plan being offered will tell the union members that give away wages in order to get good healthcare that they will lose their healthcare because Washington is going to come in and tell them that they have a better plan," end quote. Look, just because certain people happened to make some gains within the confines of a shitty system doesn't mean we should maintain that shitty system for the sole purpose of making them feel good about the gains they made. By making this argument, you're basically saying that preserving that warm feeling of union member accomplishments is more important than providing comprehensive healthcare for all Americans. This also seems to me to be a version of the sunk cost fallacy. Well, we've already invested so much time and energy into trying to make things work within this crappy healthcare system, so we might as well just keep on our present course so as to not make that feel like wasted time. Maintaining our current system or only making minor tweaks to it simply to save face doesn't seem like intelligent policy to me. And if you're concerned about the wage increases that were traded for healthcare benefits, once single payer becomes law, these union members could simply do what they were eventually going to end up having to do anyway: engage in further rounds of negotiations as circumstances require. It's not like their present agreement is forever set in stone and that was their one chance to establish the terms. No, these are fluid agreements that are constantly being modified and renegotiated. So this entire argument really seems like a red herring to me. And don't union members tend to be strong advocates of worker solidarity and improving conditions for all of us in this country? Why would they not support universalizing the kind of healthcare benefits that they have, and instead selfishly want to hold on to the gains that they've made while saying too bad for everybody else? This seems to me a perversion of what it is that union members would actually want for this country. And Delaney seems to be taking this one personal anecdote of his and using it to speak on behalf of all union members in America. In a way to portray the most pro-union candidate as a de facto enemy of unions. That's like complaining about Bernie Sanders excessively pandering to billionaires. It's absurd on its face. I'm trying my best to imagine how this conversation will go down at the construction site. Who does that Bernie Sanders think he is with his 100% rating from the AFL-CIO? It's about time someone stood up for the private insurance industry in this country. Am I right, boys? Yeah, that's right. I say we head on down to the John Delaney rally starting in 15 minutes and support a real American president. What do you say? They're like, wait, you're totally just John Delaney wearing a fake mustache, aren't you? He's like, what? No, that's ridiculous. During the 2016 primaries, The Intercept reported that, quote, every major union or progressive organization that let its members have a vote endorsed Bernie Sanders, end quotes. Why, if union members are so opposed to Medicare-For-All, which is a centerpiece of the Sanders campaign, did they overwhelmingly support Bernie over Hillary when they were given the chance to vote for him? Another problem for me is the basic premise that healthcare should be tied to employment status. It's like, cool, your union healthcare package might be great, but what if you grow to hate your job there, or hate the toxic people that you work with? That puts you in the awkward position of either quitting your job and losing your healthcare benefits, or staying there to retain the benefits and hating your life every single day. I take the bold stance that people should hate their life every day for reasons other than their day job. Yes, it's true that people can receive COBRA continuation coverage after they quit their job for a time period in the ballpark of 18 to 36 months. So this certainly would make it easier to quit a job and find another one without worrying about immediately losing your health insurance. Still, if it really is a great healthcare package, the worry that you might not be able to find a job with comparable benefits might persuade you to stay with the company or stay in a career that you no longer enjoy. A major source of depression and unhappiness in this country is people hating the work that they do, and our healthcare system only exacerbates that problem. I would much prefer a system where everyone has a great healthcare package, no questions asked, and if they want to switch jobs for whatever reason, they'll no longer be held back and limited by employer-provided health insurance. I also take issue with the viewpoint that by eliminating duplicative private insurance, we're taking something valuable away from people. John Delaney, for example, in one of the debates said the following.
But why do we got to be the party of taking something away from people?
No one is the party.
That's what they're running on. They're running on telling half the country that your health insurance is illegal. It says it right in the bill.
All right. Delaney only pays attention to what he thinks are the good things we're taking away from people. But what about all the bad things that we're relieving them of? Things like financial stress, co-pays, premiums, deductibles, claim denials, hours spent arguing about bills, and skipped medications and doctor visits due to cost. Even assuming his viewpoint that there are real benefits to maintaining private insurance, there are real downsides as well, and I would argue that a cost-benefit analysis of switching to single-payer makes the trade-off well worth it. Also understand what the Sanders bill is actually calling for, quote, Section 107, Prohibition against duplicating coverage. It shall be unlawful for a private health insurer to sell health insurance coverage that duplicates the benefits provided under this act. Nothing in this act shall be construed as prohibiting the sale of health insurance coverage for any additional benefits not covered by this act, end quotes. There's an obvious distinction between banning all private health insurance and banning health insurance that duplicates already provided government benefits. Rather than constantly being on the defensive, I would flip this question around and ask, why even allow duplicative insurance? Adam Gaffney, writing for The Nation, makes the following analogy, quote, you wouldn't buy a private plane hawked by a company that promises you access to Central Park. You already have that, end quotes. Now, he and others do point out that it's not as simple as duplicative insurance being a totally worthless scam. Jeff Spross on this point writes the following, quote, why ban duplicative coverage? Because while the government covers everyone, private insurers can limit their customer pool by charging high premiums, which could also allow them to reimburse healthcare providers at a higher rate than the government's. If your doctor accepts both your government coverage and another patient's private coverage, they might privilege the other patient or move them to the front of the line because their coverage gives a more generous reimbursement. It's basically a question of how high a priority you put on fairness in your healthcare system. In different countries with single-payer systems have decided this issue differently. Medicare already bans any private insurers from offering the same coverage it offers. Canada's single-payer system does this too. The point is, there's a perfectly logical reason for the ban, and it's hardly unusual, ends quotes. He also points out that while supplemental insurance would still be allowed under the law, there wouldn't be much left for it to even cover. Quote, the Sanders plan would cover hospital visits, primary care, medical devices, lab services, maternity care, and prescription drugs as well as vision and dental benefits. Sarah Cliff pointed out at Vox. The plan is significantly more generous than the single-payer plans run by America's peer countries. The Canadian healthcare system, for example, does not cover vision or dental care, prescription drugs, rehabilitative services, or home health services. In other words, while Sanders' plan doesn't ban supplementary coverage from private insurers, it does offer such generous coverage by the government that there's not much room left for private coverage to fill any gaps, end quote. So now that we're clear about how exactly these private insurance bans would work and what their purpose is, let's return to Delaney's points. Quote, why do we gotta be the party of taking something away from people? That's what they're running on. They're running on telling half the country that your health insurance is illegal, ends quotes. Why get rid of all this private health insurance, he asks. The short answer is because it fucking sucks. He acts like we're taking something good away from people, when I would argue it's more like we're cutting a cancerous growth out of the body. If you know anything about how the health insurance industry functions in this country, I feel like Delaney's question answers itself. Elizabeth Warren summed it up very nicely when she said the following.
Look at the business model of an insurance company. It's to bring in as many dollars as they can in premiums and to pay out as few dollars as possible for your health care.
By getting rid of this private health insurance middleman, what we're doing is prioritizing the provision of healthcare over the collection of profits. Watch some of the Democratic debates, and what you'll see are centrist candidates falling over each other in their attempts to explain how much we love the private insurance industry in America. What you won't hear them mention is that according to a 2016 Harris poll, only 16% of Americans believe that health insurance companies put patients over profits. And there's good reason for the skepticism. Anyone who's dealt with claim denials or skyrocketing premiums has experienced their zeal for profits firsthand. Try asking a group to tell you about a good experience they've had with a health insurance company, and the room will be so quiet that you'll think Amy Klobuchar just told a joke. Ask about their health insurance horror stories, and you guys will be there all night long. Here is one of many such examples. Quote, Kara Pressman, the 15-year-old, tried to absorb the devastating news relayed by her parents, that their insurance company, Aetna, denied her for a minimally invasive brain surgery that could end the seizures that have haunted her since she was 9 years old. When my parents told me, I went kind of blank and started crying, she said. I cried for like an hour. In the 6 weeks since the denial, Kara has had more than 24 seizures affecting her everyday life, ends quotes. Worth underscoring is that insurance companies will refuse to pay for treatments like this, despite the fact that their clients are already paying them enormous sums of money each year. The whole point of us having insurance in the first place is for you assholes to cover these things when they come up. The Pressman family, for example, spent $24,000 on health insurance with Aetna that year, only to have them spit in their face and not pay for treatment anyway. This is a system that is completely unacceptable. And let's be clear, examples like this aren't rare aberrations or weird mistakes. This is how private insurance companies function. These are features and not bugs of our healthcare system. As they continue in the article, quote, Phil Gattone, the president and CEO of the Epilepsy Foundation, said insurance denials and other barriers to treatments have become a common battle for thousands of Americans with seizure disorders, ends quote. In a Splinter News article, Molly Osberg interviewed interviewed former employees of insurance companies, and we learned firsthand what their business practices are like. Quote, I worked as a biller for a few doctors' practices about 15 years ago. And before that, I worked processing claims for a local medical insurer with about 100 employees. I really only worked for the insurer for about a year because it was getting a bit soul-crushing listening to people cry on the phone when I would deny their claims. But that was the job. Deny if at all possible. Pre-existing conditions were a big thing then. We would deny anything if we felt we could get away with it. People's co-insurance would be so high they couldn't keep up with the bills, and it was my job to inform them we couldn't treat them anymore. That was horrible because I was talking to very sick people who needed care. I got tired of being the bad guy in that regard, so I had to leave that line of work behind. Later, when I worked in billing at a small doctor's practice, I could spend hours trying to work on a single claim. It just wasn't cost efficient dealing with private insurance. I didn't really deal with patients by that point. It was just me in a cubicle on the phone arguing with Blue Cross. They would deny for the most ridiculous reasons. Their favorite game to play was to ignore my numerous claim submissions. Then, once the filing date passed, they would tell me I missed the filing deadline, even though I could prove I had submitted it several times on time. They just don't want to pay, end quotes. When you look past the glossy brochures and explore the dark underbelly of private health insurance, it becomes puzzling to see people defending this industry as something worth preserving. It's like bemoaning the loss of Russian loan sharks that'll break your kneecaps if you don't pay up on time. People are crying about the proposed eradication of a predatory industry whose disappearance we should be celebrating. Maybe John Delaney can enlighten me, but I don't know anyone who enjoys dealing with insurance claim denials. I'm getting constantly rejected for this reason, that reason, this reason, but enough about my Tinder profile. As I explored in a previous video, you'll often hear it said that the private insurance industry keeps hospitals afloat because their reimbursement rates are much higher than those of Medicare or Medicaid. However, that same medical billing employee interviewed by Osberg said the following, quote, the Medicare claims were really what was keeping the door open. Medicare is easy. Treat the patient, check a box, get paid. No hoops to jump through. Most people believe doctors hate Medicare when in fact they love it. Claim filing and payment is easy. They didn't even mind taking slightly smaller fees because their administrative costs were so much lower. You'd be hard-pressed to find a doctor who doesn't take traditional Medicare. Not so much with the Advantage plans. Dealing with them is pretty much like dealing with private insurance, end quote. Not only is private insurance a huge waste of time and money for healthcare employees, but it's also an enormous waste of time for the people that have the health insurance. Articles with headlines like 10 steps for appealing a medical claim or bill tell you pretty much all you need to know about the needless complications and inefficiencies within our current private insurance-based system. These are just the core sections of that article. Quote, preliminary steps to consider. Get a filing system going. Step 1, get the provider's bill. Step 2, get the insurer's record. Step 2.5, if this is an employer's policy, get the employer involved. Step 3, ask the provider questions. Step 4, ask the insurance company questions and follow the appeal process. Step 4.5, if this is an employer policy, keep the employer involved. Step 5, hope you're not a strange or unusual case. Step 6, call everyone again. Step 7, what to do if you're still stuck. Step 8, we hear that sometimes you can offer to pay a lower price. Step 9, financial aid from the provider or government. Step 10, social media, change.org, and so on, end quote. And let's not forget Step 11, coming to terms with death and getting your affairs in order. Could anything be more needlessly complicated and absurd than this current system? Step 2, 3, 4, 4.5, 5, 6, 7. Think about all of that wasted time that could have been spent mindlessly scrolling Facebook and playing Words with Friends. How about instead of all this bullshit, we just fund our healthcare at the governmental level and everything is taken care of just like that? Their last recommendation in this article in part tells people to go to social media and hope that you can generate such a large outrage campaign that the decision eventually gets reversed. Other articles with a straight face will tell you to start a GoFundMe page and hope that you can beg and grovel enough that you'll get other people to help pay for your medical bills. This is actual advice that you receive in this country from serious personal finance articles. Who needs a GoFundMe page when you can pay off your $80,000 in medical medical bills by working a second job on weekends and spending less money on lattes each month. It's your fault for contracting that horrible illness in the first place. What were you thinking getting cancer like that before becoming financially independent? When all else fails, just start up a GoFundMe page. This is the healthcare equivalent of doing porn to pay for college. I can't even begin to imagine how degrading it is to have to beg strangers for money like this. Anyway, please consider supporting my channel on Patreon. I can only speak for myself, but I have no interest in maintaining this current system, or leaving it largely in place with a few minor tweaks. And I can't help but notice that all of the centrist Democrats supporting such half-measure incrementalism are themselves very financially well off and completely disconnected from the absurd reality of paying for healthcare that so many Americans face in this country. I'm sure if you're a multi-millionaire like John Delaney, you feel like our healthcare system works pretty well, but try telling that to the person who has to go on the internet and pathetically beg strangers to help pay for their medical bills. Why are we who simply oppose this inhumane system the ones who are continually forced to explain ourselves? How about the debate moderators pose a critical question towards the opponents of Medicare-For-All for once? How dare you try to get rid of the health insurance industry? How dare you try to maintain the health insurance industry? How about that question for once in your fucking life, Jake Tapper? But no, same problem for him and everybody else in the corporate media bubble. With their multi-million-dollar television contracts, they can afford spectacular healthcare, so it's no wonder they take a defensive stance towards the status quo. Add to this the fact that many of these profit-bloated insurance companies spend enormous sums advertising on cable news, and there's a built-in incentive to not rock the boat too much unless you want to lose some of that sweet, sweet advertising revenue. In a Motley Fool article, Keith Spites argues that these critiques of private insurance are widely over-exaggerated. The title of the article is 5 Myths About Those Despicable Health Insurers. First thing I did was check this guy's bio, because I knew just from the tone of the article that he's gotta be on the payroll of the insurance industry. Sure enough, quote, his background includes serving in management and consulting for the healthcare technology, health insurance, medical device, and pharmacy benefits management industries, end quotes. Why am I not surprised? I wonder what advice a health insurance consultant even brings to the table. He's at a boardroom meeting like, yeah, great job ripping people off last quarter. Keep up the good work. Now, of course, his ties to the industry don't automatically make his arguments unsound, so let's see what he has to say. Quote, myth number 2, health insurers deny a large percentage of claims. Some people might have the impression that health insurance companies deny claims frequently. That's actually far from the case. Even when denials occur, it usually doesn't involve the entire claim and only impacts specific charges, referred to as claim lines. Cigna has the lowest rate of the Big Five, denying only 0.54% of claim lines. United Health denied 1.18% of claim lines. Aetna and Humana weren't far behind with 1.5 and 1.97% denial rates, respectively. Anthem was the highest of the group with 2.64% claim line denial rate, end quotes. So the average of these claim denial rates is 1.6%, according to these numbers. I wouldn't exactly call health insurance companies failing to pay for things 2% of the time a great victory. That still translates into millions of stress-inducing claim denials every single year. Under a comprehensive Medicare-For-All system, I don't know that we'd see any claim denials, because almost everything would be free at the point of service and already paid for in advance via tax dollars. I'd much prefer that system to rolling the dice every time I visit the doctor and hoping and praying that my health insurance covers it. I also don't know how exactly this 2013 data was gathered, and I couldn't find information on it, but Jacqueline LaPointe tells us that, quote, payers are oftentimes hesitant to release the data, especially how often they reject claims because of competition. They tend to keep the information private or restricted to prevent potential customers from passing them up for a payer with a lower denial rate, end quote. So it's possible that this data underestimates claim denial rates. More recent data on this question finds a much higher rate than 2%. The Kaiser Family Foundation found an average in-network claim denial rate of 18% in 2017. And this data I find more trustworthy because it better agrees with my preconceived notions. No, it's more trustworthy because it's subject to increased transparency laws passed as part of the ACA. Quote, the Affordable Care Act requires periodic data reporting by group healthcare plans and by health insurance issuers in the individual and group markets to make more transparent transparent how coverage works in practice. The law requires these data to be available to state insurance regulators and to the public. In 2016, the Centers for Medicare and Medicaid Services began collecting ACA transparency data, end quote. This is probably the most centrist Democratic reform I could think of, by the way. Maintaining the private health insurance market while simply better informing us of how they're screwing us over. Thanks to these transparency laws, the data shows that far from the rosy picture Keith paints for us, claims are denied almost 20% of the time, and this is for in-network claims here. For what it's worth, a 2011 GAO report arrived at a similar number, quote, "The state data indicated that coverage denial rates varied significantly across states, with aggregate rates of claim denials ranging from 11% to 24% across the 3 states that collected such data," end quote, translating into an average claim denial rate of 18%. You might argue this isn't the end of the analysis because people are still free to appeal these claim denials by following an 89-step process that only takes them 6.5 weeks. True, but only a small percentage of people go through all this trouble, and only a small percent of denials are overturned. The KFF reports that, quote, "Enrollees only appeal a tiny share, 0.5% of those denied claims. On average, appeals resulted in a reversal of the initial denial in 14% of cases, though with wide variations among individual insurers, which had reversal rates ranging from 1 to 88%, end quotes. 14% of 0.5% equals 0.07% of claim denials being successfully reversed. But hey, at least our healthcare system gives the rest of these people a chance to desperately plea for help on GoFundMe, the online equivalent of being a beggar in the street. Now, the really astute health insurance apologist would point out that according to that same 2013 AMA report, Medicare claim denial rates were 5%, higher than it reported for private payers. So how could you argue that Medicare-For-All is a solution to this? Here's how. This is for Medicare as it currently exists, with its many coverage gaps and insufficiencies. The Sanders bill and others like it expand the benefits to so many different areas that claim denials would become virtually non-existent. The other point to make is that the vast majority of these claim denials come from Medicare Advantage, which utilizes private insurance companies. As they point out over on Dover Healthcare Planning, quote, "Some 38% of the Medicare Rights Center's helpline calls about denials of coverage in 2013 dealt with Advantage plans, almost 5 times as many complaints as for traditional Medicare. Since only 30% of Medicare beneficiaries are enrolled in Advantage plans, that means you are 15 times more likely to have a claim denied in an Advantage plan than in traditional Medicare," end quote. So this data actually proves our case and not yours. Keith also hilariously thinks he's debunking the myth that health insurers mess up payments frequently by pointing out that according to this AMA report, they only mess them up about 5% of the time on average. Considering that insurance companies are pretty much in the business of processing payments, that's a pretty bad track record in my opinion. Serious question for everybody watching. If you consistently fucked up a central part of your day job 5% of the time, how long would it take for you to get fired? Imagine a cashier or a bank teller with this sloppy a success rate. Something tells me the company wouldn't keep them around for very long. Yet when it comes to the health insurance industry, these embarrassing numbers are the norm, and according to Keith, they're apparently something to be proud of rather than ashamed of. I mean, at the very least, I wouldn't call these numbers a selling point of insurance companies. Thank you for choosing Johnson's Taxi Service, where we only take you to the wrong place 5% of the time. Let's recap the key points made here. Contrary to what centrist Democrats imply, Medicare-For-All wouldn't take healthcare away from people. It would provide comprehensive care to every single American citizen. It would also bring more equality to our current system that favors the wealthy. Union members are actually very supportive of the Sanders platform, and universalizing healthcare in this country would make it much easier for people to move on from a job or a career that they hate. Even if people like their present insurance, replacing it with something better and cheaper isn't the worst thing in the world, and sharply restricting the predatory role of the health insurance industry would be a good thing, not a bad thing. Yes, Medicare-For-All would eliminate duplicative health insurance, and it would also eliminate high co-pays, deductibles, and premiums, in addition to costly claim denials and time wasted appealing them. Here is one claim that no insurance company can deny. You should support my channel on Patreon. My videos take a lot of time and energy to produce, and thanks to rampant demonetization as well as the widespread use of ad blockers, I only make a fraction of what I could be making on YouTube. Supporters receive access to my world-famous bonus videos. You can also follow me on Twitter at @skepticalhuman, and if you click the bell, you'll get notified when new content is posted. Thank you all for watching and listening, as always, and until next time, take care.